In this video, we are going to see about benign prostatic hyperplasia. Before that, I will introduce myself. This is Priyadarshini, tutor from Sns College of Physiotherapy. Benign prostatic hyperplasia is a condition which comes under the paper General Medicine, General Surgery, Pediatrics and Geriatrics of second year BPT under Tamil Nadu MGR Medical University. So, benign hyperplasia is a non-malignant enlargement of the prostate gland due to the hyperplasia of stromal and epithelial cells, mainly in the transition zone, leading to the lower UTI and bladder outlet obstructions. So it is one of the non-malignant enlargement or the inflammation of prostate gland due to the epithelial cells or hyperplasia of stromal cells. It is very common in elder males and prevalence is about 50% in 50 years and above men and 80 to 90% in 70 and above 70 years and above male. The global burden, it affects around more than 200 million men. Incidence increases with the age and metabolic factors such as obesity. The etiologies of the benign prostatic hyperplasia are the age, hormonal influence like testosterone is converted into dihydrotestosterone, which stimulates the growth of prostate, and imbalance between the cell proliferation and apoptosis. Other contributing factors are genetics, family history, DNA, etc., and obesity and chronic inflammation. So, benign prostatic hyperplasia is due to smooth muscle hyperplasia or prostatic enlargement. These two leads to the bladder dysfunction and it may cause the lower UTI. The clinical features of benign prostatic hyperplasia includes the signs and symptoms and clinical features of lower UTI, frequency of urination, urgency of urination, nocturia, incomplete emptying, intermittency, straining, weak stream and hesitancy are the most common. And acute urinary retention and recurrent UTIs are also the complications of benign prostatic hyperplasia. Investigation. The investigation may be of physical exam or uroflowmetry or post-voidal residual urine measurement, prostate specific antigen and urinalysis. Ultrasound, urodynamic studies also plays a vital role in the investigation of benign prostatic hyperplasia. In urodynamic studies, they will take the blood test and cytoscopy. Blood test for the renal function if the retention is suspected. Differential diagnosis include prostate cancer, prostatitis, which is painful and tender prostate, urethral stricture, bladder and neck contracture or stones in the bladder, urogenital bladder, overactive bladder and restricted underactivity, medication causing urinary symptoms like anticholinergics, etc. The medical management of benign prostatic hyperplasia include first line of mild to moderate symptoms, alpha blockers and 5-alpha reductase inhibitors. The alpha blockers are the tamsulosin, alfuzosin and silodosin, and the 5-alpha reductor inhibitors are finasteride and dutasteride, which reduce the prostate volume by inhibiting DHT, dehydrate testosterone, and slower the onset, best for larger prostates, that is greater than 40 grams. Combination therapy of alpha blockers plus 5-ARI for larger prostates are high risk of progression. Other PDE5 inhibitors like tadalafil for lower UTI and erectile dysfunction. Lifestyle modifications and lifestyle managements like fluid management, avoidance of caffeine, alcohol, and timely voiding are the medical management or the lifestyle modifications for the benign prostatic hyperplasia. Surgical management may include severe symptoms, refractory of medical therapy and complications, and common procedure includes the prostatectomy and transurethral incision of prostate. For smaller glands, they will open the gland and they will operate the prostatectomy. Open prostatectomy is for very larger prostate glands. And the risk factors are retrograde ejaculation, incontinence, and TUR syndrome. TUR syndrome is transurethral resection syndrome. And physiotherapy management may include the goals like improve bladder function, reduce symptoms, improve quality of life. Interventions like pelvic floor strengthening, like Kegel exercise, bladder training, post-operative cases, breathing exercise, early mobilization, weight control, regular physical activity, avoidance of physical, excessive alcohol and caffeine, early screening of elderly males. Summary: BPH, that is benign prostatic hyperplasia, is a non-malignant enlargement of prostate gland due to DHT mediated hyperplasia, which is commonly affecting the elderly men. It causes lower UTI due to the bladder outlet obstruction. It diagnosed by DRE, PSA, ultrasound, and the management includes alpha blockers and 5-ARI and TURP. Thank you. The references are from Davidson, George Matthew, Alangappa, and National Center for Biotechnology. Thank you.